everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be discussing NEXUS criteria. Let's break it down. NEXUS is an acronym and it stands for National Emergency X-Radiograph Utilization Study. We use this test when we want to clear for a cervical fracture. Let's break down the inclusion criteria. There are 5 conditions for our NEXUS criteria. We want to look at these criteria if our patient is reporting a recent head or neck trauma. Let's look at them. Number 1, posterior midline cervical tenderness. 2, evidence of intoxication. 3, not alert oriented to time, place, and event. 4, focal neurologic signs present. And lastly, 5, painful distracting injuries present elsewhere. Now, if this is present anywhere else on the body, it doesn't necessarily have to be the neck or face. Now, something important to note, our patient does not need to have all 5 for this NEXUS criteria to be considered. The patient could have 1, 2, 3, any of them. They have to have at least 1. Now, what happens if our patient does have 1 or more of these criteria? Well, this is when we would need to order or refer our patient to have radiographs done. That is the whole purpose of our NEXUS criteria, to figure out if a radiograph should be ordered to clear for a cervical fracture. I hope you guys learned something in this video. Come back to my page to learn more.